In our last mini lecture, we discussed the 4 stages of helping. Today we'll talk about core skills and attributes. In all 4 stages of helping, you will need to possess some core skills, meaning what you do, and attributes, meaning how you are, in order to work effectively with clients. The core skills and attributes we'll be discussing are self-awareness and self-reflection, mindfulness, self-care, and self-compassion. Self-awareness refers to being highly observant of oneself, while self-reflection means engaging in self-monitoring or self-regulation. So this is not about being self-absorbed and purely focused on yourself. This is about having the ability to introspect, the ability to view your own behavior, be aware of your own behavior and your interactions with clients. And not only do you have to be aware, you have to engage in self-monitoring and self-regulation, meaning you have to have the ability to change that behavior, to bring that behavior more in line with what you want to see from yourself. Your book refers to this as the ability to consult your inner compass. Are you on the right path? Are you pointed in the right direction for the attributes you want to have as a helping professional? So how do you make sure that your compass is correctly aligned, to make sure that you're behaving in keeping with your expectations for yourself? The first thing you need to engage in consistently is consultation. So this can be consulting with your peers who are mental health professionals. This could be consulting with your professional organization, with the current literature. So you're always looking outside yourself for information about how to best interact with clients. You can also engage in supervision. Now, this is somewhat different from consultation. With consultation, you're working with a peer. So that's going to be someone who's on your same level to get their input on your interactions with clients. Supervision, by contrast, is working with somebody who may be more skilled in a particular area. So with consultation, the person with whom you're consulting is not taking on any responsibility for your client. With supervision, the person with whom the person who is supervising you is taking on some responsibility for the client because they're better trained, more versed in this particular situation. So you're going to them and they're taking on the responsibility of guiding you through your work with this client. So in addition to engaging in consultation and supervision, you always want to look to your ethical and professional guidelines. So what is your code of ethics? What does your professional organization say about how best to carry out your work? Mindfulness. This is focused attention, remaining aware and attuned to the present moment. Now, this is something that many people struggle with. Today our society is so focused on multitasking. Many of us engage in multiple activities at one time. You may be talking to a friend and also watching a video or looking at your phone, or we engage in many different activities at the same time. And even if we're not engaged in multiple activities, we may be engaged in one activity, but our mind is somewhere else or thinking about something else. And this is something you cannot do in your counseling sessions when working with clients. You have to remain purely focused on the client. So this is something that will take some practice in order to master the ability to be mindful, be purely in that session, focused on the client and not thinking about things outside the session or even thinking about the next thing you're going to say. You need to be purely in the moment with the client in that session. Self-care. Self-care for helping professionals is not a luxury. It's an ethical imperative, meaning in order to practice ethically as a helping professional, you have to care for yourself. We talked about, I believe in our first mini lecture, the fact that you are the vessel through which you work. You are an important part of your work as a helper, so you cannot neglect yourself. Engaging in self-care prevents ineffective or harmful client care, so it stops you from harming clients, but it also promotes beneficial care, meaning that not only are you not hurting clients, but you're helping clients. So through caring for yourself, you're better able to care for your clients. And in class, we'll talk more about different types of self-care. This is not just getting your nails done or spa days. This is caring for your mind and your body. So it can be things like engaging in exercise, making sure that you have meaningful relationships, making sure that you feel emotionally supported. So things that help you care for yourself as a helper. Self-compassion. This refers to self-kindness and self-understanding rather than harsh judgment or self-criticism. Now, all of us have achieved this level of academic success because we are hard workers, because we're driven. But also that can come with some perfectionism and some really harsh self-criticism. And often people think that the best way to pull the best performance from themselves is to be overly harsh and overly judgmental. And this is not true. You need to be compassionate toward yourself, and this will help you be more compassionate toward others. If you're very strict and harsh with yourself, that may carry over to how you treat others. So if you're not showing compassion to yourself, you may find it difficult to be compassionate with others. Now, this doesn't mean not holding yourself accountable. There's a way to hold yourself accountable without being overly critical. So, for example, if you make a mistake, you don't have to say, oh, you embarrassed yourself, you're stupid, oh, you look crazy. No, is that how you would talk to somebody you love? Most likely not. If you see somebody you love make a mistake, you would probably tell them something like, you're just learning, you made a mistake, you'll learn from your mistake, and you won't do the same thing again. So speak to yourself in the same way. So again, you're holding yourself accountable for the mistake you made, but you're being gentle with yourself and realizing that, especially early on in your helping career, you're going to make mistakes. You have to expect to make mistakes. But instead of ridiculing or insulting yourself for those mistakes, just realize that you'll use that to help you make better decisions in the future. So engaging in self-care and self-compassion will help you prevent burnout. Burnout refers to emotional depletion, lack of caring or empathy for your clients, and a diminishing sense of personal accomplishment. So I know we've all heard the adage of when you're on an airplane, if something goes wrong in the plane, you have to put the oxygen mask on yourself before you help somebody else. And the same is true as a helping professional. You have to make sure that your emotional needs are met, that you feel cared for, that you're caring for yourself. Because if you're perpetually in a state of neglecting yourself, you will become depleted and you'll find it hard to feel empathy toward your clients. So if your emotional needs are not being met, when somebody asks you to help them attend to their emotional needs, you won't be able to do that. You won't be able to feel the empathy toward them that you should as a helper. And burnout can also lead to a diminishing sense of personal accomplishment. You may find yourself having thoughts like, my work is not making a difference. Why am I even doing this? I'm unappreciated. It's not really helping anybody. So those types of thoughts are indicators of burnout. And that can be prevented in part by engaging in self-care and self-compassion.